afternoon, everyone. My name is Liam, and this is my friends.
My name is Khadija. My name is Sahar.
My name is Abra.
So today our topic is the potential of wearable technologies in monitoring and improving mental health. So, as we know, most of us think that the wearable technologies like smartwatch, headbands, and everything like Apple Watch, but it's not. The first invention, which is glasses, back to 1263. 1263. So the wearable technologies helps people to take care about their mental health. So they track heart rate, sleep patterns, and their levels of depression and anxiety. So the wearable technologies helps users to know more about their what happened to their mental health, which is the heart rate, depression, and anxiety. And it helps also the doctors and the therapists. So it's affordable also, but not that much. It's affordable for most of the people, but for other they are not, because they use expensive materials. So they can use expensive, high-cost qualities for the data to get it from the users. So, can wearable technologies improve and monitor? Can wearable technologies improve their mental health in the future?
Wearable technologies already started improving mental health by transforming and predicting how we manage it. And today I'll be highlighting two key advantages of wearable technologies, early symptoms prediction, and the role of glucose monitoring in mental health. So first, one of the biggest breakthrough in wearable devices is digital phenotyping, which is actually the process of collecting and analyzing data from wearables like smart watches, smartphones, trackers, and analyze this data to provide real insight depend on each person. And a recent study made in 2020 by Benjamin Griffin and Ken Standards showed that wearables can detect signs like headache and increased heart rate, or like insomnia, which is actually can be a sign of mental health disorder. These devices allowing real-time collecting data to provide like accurate analyzing of the data. And another example that there is this biochemist, French biochemist called Jessie. She found that there is a relationship between glucose spike and mental health. She was able to find this relation because she was using a continuous glucose monitor, which also called CGM, that tracked the glucose levels in her body. She found that on the days that she's active or like her mental health is stable, she's productive, she's not lazy or like she's not having like a mood swings, she found that her glucose levels are really high and irregular. But on the other hand, she found that when the glucose levels are normal or less than what it was, she found that she's productive and her mood is stable. So this is how she knows that there is a relationship between glucose levels and mental health by using the CGM device.
Okay, so despite the fact that you talked about the positive side of wearable devices, like early detection and analyzing signs of mental disorders, I would want to argue that I talk about a negative side about wearable devices. is over-dependency and reliance on wearable technologies. Users said that overly or obsessively checking their wearable devices to check their mental health caused them to have more anxiety and stress. So a 2024 study said that users had an increase in anxiety due to continuously checking their mental health and being obsessed with it. Also, another negative side would be that devices can, or users can actually misinterpret some signs, like it can give them a false alarm, like low oxygen levels or heartbeat, and this can cause unnecessary panic. Another study is a study published by American Psychological Association that found that 40% of users using wearable devices had an increase in anxiety and depression. The last example I would be saying is the nocebo effect, which is that if the wearable device actually warns you about having anxiety or a sign of anxiety, you can start feeling more anxious about it and having actual anxiety where it wasn't there.
I understand your point, but I think that we can address this issue by educating the user themselves on how to use these devices. Wearable devices, their advantages outweigh their disadvantages, so we just can't judge that just because of some users find that over-reliance on wearable devices can lead to anxiety, can let the good part that it actually help the doctor on analyzing or diagnosis the disease, the mental disorders. Again, it's a tool. It's not like a replacement for the professionals, therapists, or the doctors. So we can just educate them and
Also, as we know, the mental health. Treatment requires in-person visits with the doctor or the therapist. So sometimes can be time-consuming and costly for some people. So wearables can help you by allowing the remote monitoring. Okay, so the doctors or the therapists can check the patient's mental health by just checking the devices, and it's actually easier for the both of them, the professionals and also the patients. The patients, all they have to do is to wear their wearable devices, such as smartwatch and smart rings, also like mobile apps. And for the patient, for the professionals, they can check their data, wearable data from the AI driven app to analyze it for the patient to make it to improve their mental health well-being. Guys, also there is concern. There is concern, especially the privacy and security. So the wearable technologies need some health information to make the wearable device accurate for each person and for each app and for each person. So for example, they make headbands for someone, they make smartwatch, they make glasses. So it depends on their product, and their mental health issue. And one of the studies, which is established in 2024, it mentioned that sometimes the health information is not accurate and it's not accuracy for each one. So it will make for them some issues about making the devices affordable another concern, which is the affordable. The affordable thing is some of the people, they think that the wearable devices is so expensive for them, they cannot buy it. So they think that maybe the therapist and the doctors, maybe they have the less price than to buy it, the wearable device. So what do they think? That they can make it expensive just for the data storage. So yeah, what do you think, guys, about the concerns?
Yeah, I also there's companies like Google and Meta have actually problems with the security for wearable devices and data because it works on collecting data from users. So users found that it affects their privacy and it had ethics concerns. So yeah, I would support your argument as well.
And actually, there are real life examples of this app. It's called Strava. It exposed one of the users' location in the recent years, and it was as you said, privacy concerns. But you actually mentioned the accuracy also. But I think wearables are actually more accurate because it's real time and continuous. It's collecting the data every day through the year whenever you wear it. It's not like a clinical visit 2 to 3 months. You can always get the data, and
It doesn't depend on personal opinion, and it can't be affected.
self-reported.
Okay. Can I answer your question? Yes.
Study supports the high cost wearables.
Okay, there's a study published by telemedicine reports that says that Wi-Fi accessibility it can not be affordable to everyone. So this makes wearables also not affordable to everyone. Okay, thank you so much for this. Thanks so much. To conclude, we can say that wearable devices have both positive and negative aspects. It can help to early detect and take signs from users and collect data to make it more personalized. But it also has some concerns like privacy and lack of human interactions, which is a very important thing for in mental health. So I would say it has both sides.